Morning, ladies and gentlemen. This is an edition of Americans for Prosperity, giving you what the people want. A discussion on telemedicine. About 5 minutes from now, we're gonna have a very interesting doctor. I do not want to butcher the name, so I'm not going to pronounce the first name, but Dr. Shah is, I believe, how you say the last name. Please don't quote me on that. I could be wrong here. But we are not interviewing this individual. This will be coming from the headquarters of Americans for Prosperity on their Facebook page. We're going to be streaming it live on our page to bring the information directly to you guys. Just wanted to bring it up a little bit early here this morning, about 5 minutes. We're going to get this stuff rolling here directly from the Americans for Prosperity Facebook page, starting right around 12 p.m. Eastern, 11 a.m. Central Time here. Just want to give a quick introduction to everybody that may not know. Telemedicine, right? So it's a term that Sean and I, David and I, have been throwing around for a little while. It's basically an umbrella term for telecommunication technologies healthcare providers offer to remotely evaluate, diagnose, and treat or monitor patients around the country. Telemedicine ensures that families, especially individuals that reside in, say, I don't know, the rural areas or urban communities or underserviced areas, that they can still access healthcare in a timely manner when medical providers are not readily available. And especially during this shutdown period that we've all been dealing with right now, one of the things that happened during Governor Lee's executive orders is that restrictions on telemedicine was lifted. Those restrictions are still lifted as we currently speak right now, to the best of my understanding. But much like happened with scope of practice for nurse practitioners, those restrictions could be reined back in or placed back on, rather. Part of what we wanted to bring you all today is just an in-depth discussion as to what telemedicine is, why it needs to be around, why we American Prosperity think here that this could do a fantastic thing for increasing the healthcare access to individuals that have never had it before. It'd also be interesting to consider a few stories as well of those that have actually used telemedicine during this shutdown period. I know that my actual GP, the general practitioner that I go to, his model had, prior to the shutdown, had actually started to shift in a little bit of a telemedicine area, but also into an area where they were just taking him and a few other practitioners had gotten together, and they were taking a couple nurse practitioners within each one of the, under their purview, and would send these nurse practitioners out to do home visits. And the practitioners will come back with the information and synthesize it through sort of the net of each one of the GPs. 2 or 3 or 4 GPs would gather together and form this little group. Telemedicine is actually something that he picked up because the restrictions were lifted during this time period. Now, he set up an interview, actually not an interview, but an appointment with me just to reach out and say, hey, by the way, during this shutdown, just know that I'm still here and I'm still available anytime you need to have a communication. And one of the myths that's we're going to be talking about, that AFP, the headquarters, is going to be talking about, I believe, is that telemedicine might deliver subpar healthcare. And the fact behind this, however, is that telemedicine has demonstrated that it can effectively treat a variety of medical conditions as effectively as in-person healthcare. And the studies have shown that telehealth can treat chronic conditions, manage diseases, alleviate mental health, and treat diabetes. Overall, at least 38% of in-person visits, including 27% of emergency department visits, could be remotely delivered by qualified providers through telemedicine. Sean, we got about 2 minutes left here before we're getting started here. I'm trying to monitor the AFP Facebook page or the headquarters page as well.
Well, I'll turn my mic on here since I'm talking to you. I'm guessing we still probably got 3 or 4 minutes. I think they'll probably be a couple minutes after 12. I still not see anything on their Facebook page, but as soon as I have something, Grant, I will probably just throw it up on the screen and mute you, to be honest.
Good deal.
Because this is we're just kind of filling time and letting you know about the topic, but the real juice of it, the real meat of it, whether you're watching live or whether you're watching back later, is this doctor. And I think everybody has had some experience with telemedicine, either on the personal level or know somebody. It's just more convenient. It's cheaper. It makes sense. And to me, when I tell people who've done it recently that it really wasn't allowed in its current form before this whole shutdown thing, they're really surprised. And I really hope people take that I don't know, that ease of experience that you had and apply that to, like, well, maybe this should happen all the time. Wouldn't that be great?
Yeah. It doesn't really seem like there's much of a reason for the restriction to be around in the first place. I'm actually trying to share this out to a group right now, but look, one of the other myths that I think people have heard there is that telemedicine might actually increase healthcare costs. Now, the fact behind this, that's a myth, we would say. The fact behind this is that telemedicine actually allows healthcare providers to charge significantly less for healthcare services. And that should be fairly obvious to most people. not least of which is obviously the labor cost involved and everything else. But telemedicine consultations cost as little as $40, while in-person doctor visits can cost, as much as $160. These lower prices allow insurers to charge families lower premiums. Now, in Florida, for example, Humana has announced a
Welcome
new
to
insurance
Americans
plan
for
option that
Prosperity's
offers 20%
Telemed.
lower premium.
Hey, I think we're ready to go, Mr. Henry.
Sounds good, buddy.
I think we're coming in a little bit late, but that's okay. I think I can catch it so we can rewind the live and start from the very beginning. So here we go, everybody.
Telemed Talks. Welcome to Americans for Prosperity's Telemed Talks. My name is Leanne, and I am with Americans for Prosperity, and we are joined by Dr. Shah. Dr. Shah, thank you so much for being with us today. Dr. Shah has a teleradiology practice and obtained his medical degree from the University of Vermont, then went on to complete his residency at Virginia Commonwealth University and his fellowship in neuroradiology from the University of Maryland School of Medicine. Throughout Dr. Shah's medical professional career, he has served on many medical boards and in administrative roles with specific interest and specialty in neuroimaging, stroke protocol, healthcare policy, and advocacy. So we're so excited that you're here today. I know myself, I'm always one for looking on the bright side, and greater access to telemedicine is one of the few bright points that's come out of this situation that we found ourselves in with COVID. And I'm so excited to talk to you about it today, Dr. Shah, because I know that it's been a passion of yours for some time. And so with that, it looks like we've got some folks live watching us on the other end of the line from home. So let's give the people what they want. Let's start with you, Dr. Shah. I'd love to hear your story. How did you become a doctor? Why did you decide to focus on radiology? Where do you practice? And what's your practice like?
Thanks, Leanne. Thanks so much for having me. Glad to be here. Thanks for all the viewers watching, and thanks for AFP for hosting this. It's really a great topic. This is the heart of what I do, telemedicine, teleradiology. I've been doing it for 8 years now, and before that, I was in private practice for some short time. But really, how did I become a physician? I'm a first-generation immigrant. I came here when I was in high school, 11th grade, did a couple of years of high school, and then went on to undergrad and then medical school, and then on and then on. And I think the main thing is radiology was not on my radar. I just wanted to be a physician. I wanted to help people, the common things that people want to do. Why do they want to become a doctor? They want to help people. They want to serve the humanity. And I think that was my interest. And I started during my undergraduate years picking up interest in neurosciences. I did my undergraduate in biology with a minor in physiology and neurobiology. I did some research in neuroscience at the time, kind of liked it. In medical school, kind of stayed interested in neurosciences, thought I wanted to be a neurosurgeon or a neurologist. I did a radiology elective while I was in my fourth year just to prepare myself for the Acton internship for neurosurgery and neurology, and really loved that imaging aspect of it, loved the diagnostics. I loved how I was still able to communicate and work with neurosurgeons and neurologists and still have my own subspecialty with diagnostics. So I chose radiology. I loved that field as a fourth year medical student. And then after radiology, I went back to my love for the neurosciences. I did my subspecialty in neuroradiology. And for the most part, I read brains, head and neck, and spines. I love that.
Awesome. And you currently have a teleradiology practice in Virginia.
I do, yes. I do,
Okay.
yes. So primary, this is my practice. This is my home office. I've been here for this home now 5 years. And before that, I was in Fredericksburg for about 4 years. And I've been practicing telemedicine, teleradiology for 8 years now.
So I know that this isn't the first time that you've joined members of Americans for Prosperity and our activists and viewers from home to talk about this subject. And so I was looking at another one of your videos that you've done with some of our staff from Americans for Prosperity, Virginia. And I saw a comment and a discussion you guys were having that just totally shocked me. So I want to make sure I get this correct.
Sure.
So you have a teleradiology practice in Virginia.
Correct.
But I want to make sure I'm understanding this correctly, that laws within the Commonwealth actually keep you from serving Virginia residents in your own community. Is that right?
That is true. Unfortunately, that is correct. So yes, I don't read for any hospitals and I don't read for any patients here in Virginia. All my patients are outside of Virginia. And everything started really because of this law that we have in Virginia called Certificate of Public Need. It's an archaic law from 1970s that a lot of states have now overturned because it was initially a federal law, which then the federal government says, we don't need this law because it doesn't make sense. But then some states hung on to it, and Virginia is one of them. And what it is it actually limits and it oversees the number of CTs and the MRI machines that one can have in Virginia. So doctors like me, if I want to start my own practice, have an imaging center with a CT scanner and an MRI scanner, so I can provide my subspecialty reads for patients, I have to apply to the state of Virginia. The state of Virginia then would have to review this application, and then they decide if it's needed. That's the need part that comes in. They're the ones who are deciding. The state gets to decide if Dr. Shah can open up a CT or MRI scanner, yes or no, based on what's around. Is there a hospital within certain area? That's a very strange law, frankly. I believe, the analogy I use for this is, a dentist can get out of dental school and start practicing dentistry without asking the state. A pediatrician can start practicing pediatrics without asking the state. Cardiologists can practice cardiology. Well, what about a radiologist? My only tool I have is the CT scan, the MRI, the ultrasound, the X-ray, but I have to be dependent on the state to say yes. And unfortunately, the state does not say yes very often to primary care doctors, radiologists.
Huh. That is crazy. And, I would imagine that would have a lot to do and impact really heavily cost and access, right? And so, I mean, those sort of limitations that you mentioned, I mean, they do impact cost and access, right? I mean, I'm asking because I know you're really passionate about this, and you're really passionate about helping to change policy and advocating for telehealth. And I remember seeing you in a video where you were talking about cost and access, and that video also had a young mother that was talking about how if it came between her getting her health needs met or her family's health needs met, and there was a problem because of cost, that she would pick her family over herself every single time. And that really hit me, right? Because I couldn't help but think how much she sounded like so many other mothers out there that I know, including my own mother, and how much of a shame it is that she had to think like that when there should be cheaper options available. So how do these artificial limitations that you were mentioning impact cost and access to people like that young mother?
It significantly does. And it's to the point that's when I started got myself interested in advocacy and talking about this. Because frankly, I realized that patients, the general population, typically would not understand why they have to pay $2,500, $3,000, or even more for basic imaging studies such as MRIs or CT scans. And when I started looking at this, I realized that, the situation is that you have Medicare, Medicaid, third-party payers, and there are these tier systems that we have in our payment methods, where if there is an imaging center or an MRI or a CT scan that is owned by a large healthcare system, such as a hospital system, the hospitals can bill for those studies based on their level, their tier, and the hospital tier is considered to be higher. So reimbursements are higher for one test. So an MRI, which is owned by a hospital system, could cost as much as I said, $2,500, even more. If you go to the ER and get an MRI of your extremity, that could be as much as $15,000. And the same thing, the same exact study, if it's owned by an independent radiologist or independent practitioner, that's not hospital owned. It's what we call as a freestanding imaging center. They can be as low as $500. And when I saw the stark difference, I said, this is not right. There's no reason for a patient to pay, their full month's rent or more for just getting one diagnostic study. And we're just talking diagnostics. We're not even talking treatments here. So patients are spending thousands and thousands of dollars to just find out what's wrong with them. And that's not right.
Absolutely. Absolutely. And I love that you mentioned your passion for advocacy. And I know just from getting to know you that you really are someone who believes in fighting for what they believe in. And I think even at one point you ran for public office to create change, right? But yes. Election cycle after election cycle, healthcare seems to be the big issue. I mean, we hear it all of the time. And so if that's the case, which it is, we hear about it all the time, why do barriers like this still persist? Why are they even still around?
I think the main issue here is that you have the hospital systems, which are just much more powerful, the healthcare systems, and you have the physicians, and you have a lot of physicians who are part of the hospital system, and they do impact legislatures. They have the system, they have lobbyists, they have time to go and talk to the legislators. Imagine a general physician or a single solo practitioner like me. How much can I do? I'm busy looking at patients and seeing studies and looking at x-rays and MRIs. How much time of my life can I spend and take out of myself and or hire even an attorney or a lobbyist firm to go and talk to the legislators? So really, it's the legislators, the laws are based on what they hear. And if they're hearing only one side of the story, they're voting and they're making the decisions based on that. They're just not hearing enough of us. And I think that was one of the reasons, Leanne, why I created that video, which is just a general basic information about certificate of public need, what the issues are, how affordable access to affordable healthcare is really a crisis. You heard that from the gentleman who was talking in the video. And I want people to look at these things. They need to realize that why do they need to pay so much for a test if the same thing can be done for so much cheaper? And the options are available only if our system could make them available for us.
Absolutely. Yeah, folks, if you are just joining us, my name is Leanne. I am with Americans for Prosperity, and we are joined here with Dr. Shah, and we are talking about telehealth and telemedicine. And I really appreciate that you brought up the fact that we all have to be able to tell our story, right? And that's exactly what we believe at Americans for Prosperity, in telling your story. If you have a story about telehealth, share it with us. Send us a message using that hashtag Telemed story, or visit us at www.afptoolkit.com. So switching gears here a little bit, Dr. Shah, I'd love to know, how has telemedicine changed since you started your practice?
Significantly. It's amazing that right now, I think when my practice, as most people that we talked about, I'm not teleradiologist, so I look at images, CT scans, MRIs, and 70% of the telemedicine or telehealth business is still radiology. 30% is primary care, is the other subspecialties. And what has changed over time, initially, this is not a new concept, but I was in medical school back 20 years ago. I remember when I was in Vermont, the trauma surgeon there was logging on to using a very low internet connection speed, but was able to look at a rural hospital and evaluate a trauma case there, and then stabilize the patient so they can then get them to the level 3 trauma center, the higher level trauma center. But when I saw that, that was when I realized that there's so much power to what medicine can be accessible to so many people using this method of technology, of being able to see a patient miles away, cities away, and be able to assess and take care of that patient. And then over the years, what has happened, hospitals have still used it. When you have a rural hospital, sometimes it's hard for them to get doctors to work for them, or they're having trouble recruiting. So sometimes they're dependent on telemedicine. When I worked at the Spotsylvania Regional Medical Center in Fredericksburg, initially they had a lack of neurologists. So they used to use teleneurology, where a patient comes in with a stroke into the ER. A neurologist from a different state sometimes is looking at the patient, assessing the patient, and then making the diagnosis and evaluation. And what has changed now is it's telemedicine getting into patients' homes, which I think is very exciting, very interesting. I just talked to an orthopedic surgeon a couple of days ago, and he said that he has never, ever, he's a senior surgeon, he has never practiced telemedicine ever, but now he says that he sees the power of it, because he sees all his patients from home now, and he realizes follow-up. Think about follow-up visits, even for surgeons. Patients have trouble getting into the car, getting to the doctor with their hardware, with their post-operative state. So imagine you can now make the doctor available to their home. It's phenomenal. It's great. It's actually very affordable, and it's fast. So I can't think of a better way to practice medicine than telemedicine for patients to get better access to healthcare, faster and affordable as well.
Amazing. Well, I obviously can't speak to the doctor side of it, but I can speak to the patient side of it. And as someone who has herniated discs, it would be really wonderful if I didn't have to go and visit the doctor for every single visit if I have a flare-up, right? It is very painful to travel in the car and to be sitting for long periods of time sometimes. So I really appreciate that. And actually just last week, I used telemedicine and I was able to connect with my primary care physician over Zoom. And it was an unrelated appointment, but it was wonderful. I called them and I said, hey, I'm having this problem. Do you think I could make an appointment to come in? And they said, well, how about today at 10:30? We'll meet you on Zoom. And so within an hour of me calling my doctor, I was in front of her and we were able to have a conversation. And it was an absolutely wonderful experience. And so from the patient side of things, I can personally attest that it's great, right? It really is.
It's excellent. And what you mentioned, we're now taking it, the technology is getting so much better. We now have mobile teleimaging. So the example that you gave, what if someone has back pain and they think they have a herniated disc or they have a bad facet or bad degenerative disease in the back, and they're just suffering with pain, but they're not able to get to the physician because of COVID right now or for whatever reason. And now you can, not only can the physician see you, but they can also order tests for you. So you can actually have a mobile van that can come to your house and get an X-ray of your lumbar spine. And the images can be accessible to the physician within, again, minutes to hours. They can see it, they can assess and say, yes, we have a reason for your pain. We actually have the images. It all makes sense. And this is how we're going to treat this now. So it's really an amazing, all like 360 evaluation from home.
Awesome. I love just hearing about all those just recent innovations in healthcare, right? It's in the telehealth area, it's just dramatically changing the face of healthcare. It's so cool. So I've had this positive experience. You've had a super positive experience. For those who are maybe having a struggle internally, wondering how can a doctor really be able to connect with their patient without being there face to face? Could you just touch on that a little bit of how do you address that with someone coming with a concern? Because I'm sure not everyone on this call has had an experience like you or I have. So how can we kind of talk them through those internal barriers that you might have around this?
Absolutely. I think a lot of practice in medicine really has a lot to do with, number one, getting the appropriate history. You can get appropriate history by talking to the patient via telemedicine or in person. You're doing the same exact thing. The patient is giving you all the information. Second is looking for the signs and symptoms. And often we're observing you as a patient while we're talking to you. So if you're saying you're having trouble breathing or shortness of breath, we're obviously observing you at the same time. We're seeing if you have, changing in your face temperature, face colors, if you're having, bluish looking lips, if you're having trouble with your respiratory motion, with your accessory muscles. So we can assess you while we're looking at you. And we can also further evaluate now with the newer technologies. As I said, we can get X-rays. We can send an X-ray tech to your house, get an X-ray. So we can do lots of the same evaluation that we would be doing in the patient office. And the one part of the evaluation is a physical examination. You're not physically touching the patient, obviously, because it's telemedicine. But you can do and you can assess, do the same kind of maneuvers and tests. Sometimes if you're talking, the patient needs to bend over. If they have back pain, can you bend over for me? Can I look at you? A family member could be holding the camera and they can do those maneuvers. So you can still do kind of basic physical examination while you're away and not able to do it yourself on the patient. So there are avenues and there are ways we can actually 100% assess the patient. And obviously, if there is a need for you to be further assessed, then we would recommend and say, well, I think if you have trouble seeing, well, if I need to look into your eyes, maybe we don't have the technology yet, but we say, what, I think we need to have you come into the office now. So yes, there are certain limitations, but for the most part, for general basic triage of seeing the patient and assessing how sick they are, we can do it with telemedicine and treat them as well.
So then why have governors across the nation only now embraced telehealth in the midst of this pandemic? So we've talked about some of the successes and we've talked a little bit about like the protectionist mindset that might be around that, but why now have governors finally embraced this?
I tell you, the COVID pandemic, as devastating as it is, for telemedicine, it's been towards going forward towards the right step. Governors have had limitations. They have had resistance. They feel that maybe the quality of healthcare may not be as good, or patients may not be able to get the proper treatment. But I think that as we see the avenues that are used by telemedicine, and for the most part, as I said earlier, It was hospitals using telemedicine when they needed it, when they don't have enough physicians. So as I said, teleneurology, even tele-ICU. But now the same technology, if it's brought to the patient's house, it's no different. So, but governors need to be able to see it. They had to do that because it was an emergency. They needed patients to be seen, and they knew the hospitals and outpatient practices were closed. So it was almost a requirement or a necessity for them to go forward. But frankly, the fact that they've gone this route, they will now see the advantages. They'll now see how beneficial it is. And not will they only hear from patients, they also hear from doctors. As I said, the orthopedic surgeon that I talked to, he was surprised. He was literally pleasantly surprised at how efficient and how good telemedicine can be, how he's able to see his surgical patients via telemedicine. It's great.
Sure, sure. So I'm guessing reimbursements are going to play a key role here, right? And in providers using the technology. So kind of speaking to what you were saying about this reaction to the pandemic, if recent reimbursements for telehealth are only temporary, will providers have confidence to adopt the technology in a more permanent basis moving forward?
I think as providers use more and more of the telemedicine technologies, they'll see the benefits of it. They'll see that they're able to see Mrs. Smith or Mr. Jones, who is not able to get to the office for whatever reason. They don't have a ride, or they're extremely sick and they're not able to get out of the house. No one can get them. But when they see the avenues and they see how efficient it is, they'll be the ones who'll say, you know what, they'll push for then they will push for the reimbursements, because they realize that it makes sense. So in the CMS, the healthcare system that deals with the reimbursements, I think they're already seeing the benefits of it because they've opened it up. Initially, they were resistant to opening up a lot of the telehealth avenues for reimbursements, but they've opened it up because of the pandemic, because of the emergency. But now they realize that it is actually going to be beneficial for them, is beneficial for the patient and the providers. So it only makes sense. And I think that providers, as more and more as they use it, as patients more and more as they use it, they will see, well, this is actually very convenient. My healthcare was, my issue was taken care of faster than me having to travel an hour, wait in the emergency room or wait in the physician's office for sometimes 45 minutes to an hour, then see the physician, then come back. You're talking about half a day ordeal, which can now be done in about 20 minutes.
Awesome. Awesome. So we're about ready to be at the end of our time here. And we've covered so many topics, from just the policies around this to the actual effectiveness and the new innovation. So as we're winding down here, I just want to know if there was only one thing that people take from our conversation today about telemedicine and telehealth, what would you want that to be?
Well, I'm going to say that telemedicine is really a direction in taking a step in the right direction for making healthcare affordable, making healthcare more accessible, and improving the quality of lives of patients. Because patients who typically may not be going to the doctors or trying to delay healthcare, they don't have to anymore. They can get on their phone, on their desktops, on their iPads, and get online with the physician within 20 minutes, and get their diagnosis, get their treatment done. So we actually will see a significant improvement in healthcare with telemedicine.
Wonderful. Wonderful. Dr. Shah, thank you so much for being here with us today. Folks watching at home, don't forget to hit that like button so you get notified every time we go live and have our content streamed right to your newsfeed. If you want to get involved or learn more about our fight for telehealth, visit us at www.afptoolkit.com or send us a message with the hashtag TelemedStory. That's all from us today, and we'll see you next time.
Man, that doctor, that guy was on his stuff, right?
Oh man, that was so good.
Yeah,
that was really nice.
Like you can tell that doctor's done this at least a few times before.
Oh yeah,
seriously,
for sure.
Right?
Well, not just that, he was very knowledgeable. Obviously, like it wasn't someone who started doing telemedicine like a couple days ago or at the start of the shutdown. You know what I'm saying? This is someone who's had a lot of experience with it and give a lot of great context on. Man, I mean, some of those questions were so good because they entered right into kind of the discussion that goes on about whether or not telemedicine should be a thing. I thought it was really, really good. Any thing that stuck out to you, Mr. Henry?
Yeah, the main thing that stuck out to me is obviously, I think one of the biggest retorts that people might have when talking about telemedicine is like, well, hold on, you're not going to be able to actually properly diagnose a patient. You're not going to be able to do the practice in the way that a doctor should be practicing medicine. Practicing medicine should be all about, doctor patient, not just confidentiality, but the ability to be able to look across in the eyes of another person. And I liked how we addressed that subject in particular. We just brought this up a second ago. The information that we have here saying that, it's as far as it delivering subpar healthcare, obviously at least 38% of in-person visits, including 27% of emergency department visits, could be remotely delivered by quality providers. And the studies actually indicate that the telehealth can treat chronic conditions, manage diseases, alleviate mental health. We talked about that right before the broadcast. I bring that up one more time just to say that it's really nice to not just have statistical data, but lend some sort of anecdotal evidence from the doctor's mouth himself to show that, yes, this is obviously true. We can actually practice this across, telecommunication, like we're looking right now, right? Like a Zoom call or something like that. Show the doctor what's going on. Eric says in Facebook here as well, something talked about lessening the access to addiction treatment, such as methadone. At the height of an opioid epidemic, you would think that helping addicts gain access to statistically proven life-saving medicine would be a higher priority. Man, that is the truth, right? Goodness gracious. Let me pause. I'll not pause. I'll get back to that in just a second, because that's a great point that he just made there a second ago. He goes on to say that, but knowing many within the system and sufferers of the disease, I can tell you that access to these medicines are almost impossible for the majority of sufferers. And for those with a moral issue with this, perhaps it's disrupting for you to know that access to inpatient rehabilitation is even harder to obtain, even when the state covers it. For those wishing to seek abstinence through inpatient, having these life-saving meds can be the difference between life and death. Since COVID, many patients are finding that telemedicine and a quick trip to the pharmacy is not only more convenient, but if the price goes down, more lives are spared. I didn't even think about some of that aspect, man, right? People struggling with opioid addictions right now, people not being able to go see doctors, of just every single, how many possible situations could you possibly think of where just being able to get in touch with a doctor immediate like this for the decreased costs as well involved with this type of thing.
But also
doctors
decreased time.
Right?
So that gives doctors more time to see more people in a shorter period of time, potentially saving lives over a period of time,
I don't even think about that though, man. What Eric just brought up there as well, but the potential lives that could be saved, right? And the immediacy that you have to be able to get in touch with your doctor, that you can also help practice the social distance thing going on while being able to actually still see your doctor. Eric goes on to say both can be true. Exactly. This is why I like Eric so much, man. He hits it on the head every single time. As I was just going in, it's both can be true. Also, video chatting makes this an easy fix for a lot of people. It simply opens up another avenue to access. That's one of the other great things about this, dude. Think about the rural areas. All right, you're out there. How far are you actually from a doctor's office? I don't know how long you have to sit in your car or possibly wait in traffic or drive down the road, some of these smaller country roads. If you can just, pick up the phone or hit up an internet connection, it's one of the reasons why we're trying to get internet out to the rural areas so much as well. But I'll end with this, man. I just want to obviously thank everyone for stopping by, checking out this telemedicine thing. This will be, we're broadcasting live, obviously, but this will immediately be posted back up on the Real News Facebook page, goes on the Real News YouTube page as well. Check out this stuff later on. Check the interview back again if you want to. I would direct everyone, though, if you can, to the bottom of the show notes here at the top of our description. We brought this up David and myself brought this up, this telemedicine thing, in part because the Americans for Prosperity at the headquarters level, they were talking about it today. But more pointedly, this is an issue that we were dealing with in the legislature prior to the recess, and we'll be continuing to deal with as we go along. Healthcare is a major issue that's not just important to David and I personally. It's also very, very important to the Americans for Prosperity Tennessee family. We're actively working on trying to remove restrictions from telemedicine. We're actively working on trying to remove restrictions from certificate of need and trying to expand the scope of nurse practitioners to allow them to do a little bit more practicing so we can take some of that burden off of our doctors. From the statistics that I've received, the average age of a practitioner of a GP in the state of Tennessee is like 67. We are phasing out, purposely or otherwise. I don't know how it happened, but we are unfortunately phasing out a large portion of our healthcare providers. And in so doing, we're also seeming to gradually increase the number of individuals that are needing healthcare attention. So this is an issue that's not just near dear to our hearts personally. We're also working on this at AFP. So we just want to make sure that as we're entering the month of June, as we might be talking about some more healthcare options going forward or healthcare issues, at the bottom of the show notes there today, you'll see a link where you can actually ask your legislators to consider this issue. I mean, the recent expansion of telemedicine that we've seen during this shutdown, it provides American families better access to quality healthcare. I'm reading directly from the petition right now. Provides better access to quality healthcare and should remain in place for the crisis when this crisis is over. Telemedicine is a benefit to both patients and providers. It allows physicians, nurse practitioners, and clinical psychologists and licensed clinical social workers to offer services in healthcare facilities as well as from their homes. Thanks to telemedicine, patients have better access to remote care. The Centers for Medicare and Medicaid Services expanded Medicare telemedicine coverage to combat COVID-19, but now it's the time to make telemedicine permanent. If you want that legislator, if you want that message like that I just read to go to your legislator directly, just click that link at the bottom of these show notes here. Sends that exact message directly to your legislator. And I can't tell you how much of a difference that makes. I can't tell you how impactful that is for a legislator to get back to their inbox because they're meeting. But if y'all didn't realize this, committee meetings are going on right now. The House is opening up next week. The Senate is opening up next week, I'm pretty sure. They're meeting. They will be flooded with this stuff in their inbox. They will consider it. If not this session, you better know they will consider next session. Make your voice heard on this issue, man. Take Eric's little story there to heart about how much this can help. And I'll go ahead and end it there today, man. We just want to thank you guys, all y'all, for joining us. Just want to, get the audience ready for some of this healthcare conversations about to come up as we're entering the state of normalcy again. Love y'all as always. We'll be signing off for the interim for today. Back tomorrow morning. Do another big show. Love y'all.